There remains in many parts of society a significant, understandable, but to some extent disproportionate fear of the coronavirus. I wanted to explore the nature of viruses generally and their role within the ecosystem, together also with briefly exploring two earlier examples of pandemics and the context in which they arose. Viruses are microscopic organisms that operate parasitically. They are parasites. As a general principle, viruses are rather smaller than bacteria, and unlike bacteria that functions outside the cell, viruses only reproduce within the host cell. Viruses seem by some to sit almost at the boundaries of living organisms, but nevertheless play a significant role in maintaining health and balance in nature and within natural selection. Michich and McKenna, writing in 2017, underline the critically symbiotic relationship between viruses and living systems. Indeed, the role in which many viruses play in supporting human life, and certainly within the areas such as virotherapy. Undoubtedly, viruses and bacteria play a role in regulating and managing living systems and are a necessary part of natural selection and indeed of predation in order to maintain homeostasis or balance and health within the Earth systems. For many, though, the microscopic work, and particularly at the moment viruses, are viewed with fear and significant misunderstanding. Indeed, the idea that we should be at war with a virus is as much a category error and suggesting that we should be at war with the ecosystem. If parts of the ecosystem, in this case virus, become pathogenic, then what we have to do is look for the cause. Why has this happened? Within that context, I wanted to explore two earlier examples of pandemics. The first example I was going to look at was the 14th century pandemic known as the bubonic plague. So called as a result of the bubus, or swelling appearing in the skin surface, which was actually an enlarged and infected lymph node. Or lymph nodes, it would be a number of swellings. Bubonic plague, sometimes referred to as the Black Death, where sepsis had developed and advancing necrosis, particularly to extremities, resulted in the death of tissue and blackened areas of dead tissue appearing peripherally. Historically thought to be a bacteria, but some more recent research suggests the possibility that the bubonic plague was viral. However, whether viral or bacterial, the context of the times in the mid-14th century is worth exploring. The 14th century represents a period of significant famines. There was very extended areas of conflict, particularly within Europe, including the 100 Years' War waged between England and France, and of course a significant advance within Europe of the Ottoman Empire, generating or certainly contributing to increasing instability within the failing Byzantine Empire and states. The late Middle Ages were marked by crowding within cities, significant crowding within cities, close living, proximity to animals, increasing numbers of human and animal parasites and vectors. Despite what even the Greeks and Roman civilizations had taught many, many centuries before, there was an increasing and significant lack of public health measures and application, including, and importantly, the disposal of waste and human detritus. That matched with increasing evidence of poverty amongst many groups within societies. Within Europe, the order of the Knights Templar was suppressed and many brutally murdered. The Inquisition was also taking more concrete form and accelerating in their increasingly brutal executions. Financial and moral corruption within the church administration and within the state was manifest. There were levels of wealth, power and influence within Europe that were grossly, and I mean grossly, inequitably distributed. An unstable social, political and spiritual context or matrix in which the plague then emerges. De Witt, however, publishing some work in 2014, suggests that rather than being an indiscriminate killer, bubonic plague targeted the frail or very frail. Indeed, her examination of skeletal remains from survivors suggests that those, or at least those who survived, achieved mean extended longevity with some increased evidence of hardiness. There was also some evidence of significantly improved general health following the original plague outbreak between 1347 and 1351. In addition, there was also significant written evidence or reflection upon the cause and contributory factors to the plague emergent within Europe. The second example I wanted to look at was the influenza pandemic of 1918. This is sometimes referred to in the literature as Spanish flu, although increasing evidence suggests that it certainly didn't originate in Spain. The virus was thought to have infected up to possibly 1/3 of the planet's population, with a death toll or contributing to the death of some 50 million or probably considerably more. Evident that significant vectors of virus transmission reflected in troop movements. Troops who were tragically unaware of the increasing impact and threat of this virus, and the fact that the virus would take considerably more lives than indeed the war did. Rather than troops representing healthy young men, military diets were almost inevitably nutritionally deficient. There was significant overcrowding in camps and hospitals, with evidence of poor hygiene, and of course the very real experience of 4 years or thereabouts of industrial level war, representing horrors, murder and brutality at a level never previously experienced. A world, or at least a significant part of the world, experiencing chronic levels of stress. Chronic stress, as we know, majorly impacts in suppressing or disrupting metabolism, but importantly in suppressing the human immune system and human immune function. As the viral impact accelerated, there was evident failings on the part of authority to properly advise and to extend public health measures to society. The focus was more on celebrating the end of the war. Although, of course, the virus hadn't gone away. In both examples, one could perhaps see where human direction and the collective health had rather lost focus, almost the need for a significant call to the restoration of homeostasis or balance. Nature has to protect itself and to protect the wider biosphere. Therefore, perhaps an important, even necessary reining in, a lesson to create an interregnum and a period of reflection. We must reflect on what we had learnt or should have learnt from previous pandemics and possibly parallels to our own current experience and time. So what could we learn? What lessons should we draw from C19? Importantly and significantly, often missed in the noise of political and medical discourse, is a concern to value the human immune system, both in building and sustaining human immunity. With a healthy immune system, there is more chance of the individual, their family and community entering the 80% of the population who, if infected by the virus, either experience no, limited or moderate symptoms. There is real potential that this almost global crisis should prompt constructive change. Many reflected on the relative peace and the slowed approach to living consequential upon the emerging virus. The realization that countless thousands, or at least a proportion, do not have to trail to cities and towns every day to attend office and their place of work. Reflecting in reduced levels of pollution. Communities discovering or rediscovering community with more evidence of people supporting people. Significant and valiant efforts in accelerated research and innovation. Possibly, some reappraising our rush to economic globalization. But less positively, the realization or indeed reminder of how poor the level of health is in a significant proportion of the population, the degree to which society remains divided or class divided, and that a proportion, possibly only a small proportion, of what it's actually cost in terms of lives and resources, if invested in promoting public health sooner, could have achieved far more success at far less cost. For some, of course, this situation presents an opportunity for deeper spiritual reflection and spiritual engagement in seeking reason, and indeed direction for the future. John Kennedy, in a 1959 speech, misunderstood or misrepresented the original Mandarin, Chinese Mandarin, in suggesting the definition of crisis in the Chinese, presented with two characteristics: a challenge and, importantly, an opportunity. Nevertheless, the misrepresentation or misinterpretation of the Chinese might have applicability for our current situation. Time is pressing. So what should we take home? Most importantly, to reappraise and act on our relationship with the living world, particularly and including our relationship with animals and with nature. To reappraise our pursuit of wealth and material gain. Nature can and will respond very fiercely if we persist in disrespecting nature's sentience. Nature watches, measures and reacts to our actions and indeed our intentions. Nature has the ability to waste or destroy much of our accumulated wealth, as is evident in our current experience. Therefore, the need for a new economic theology, a making approach to economics rather than a taking or rent-seeking model. Finally, rather than living in fear, that we seize the opportunity to think and act on how we can build our individual health, the health of our families, the health of our communities, and the health of our countries. This virus has dealt a very painful hand of cards to many. That is what we have been dealt. But it is not and does not have to represent our destiny. Our destiny is not determined. It is how we play that hand. As we move through this, and we will move through this and come out the other side, we must seize the opportunity, not reproducing the old, just slightly amending or patching up the way we lived, but seize the opportunity to move forward, a dramatic change of direction. I am Dr. John Power. I'm based in Northern Ireland, and thank you for listening.